Alright, let's talk about something that's absolutely crucial before any surgery. Preoperative investigations. You might think surgery starts in the operating room, but honestly, it starts way before that. These tests are all about making sure you're fit for anesthesia and surgery, and more importantly, about keeping you safe. First up, routine investigations. These are the basic tests almost everyone gets before going under the knife. Let's start with hemoglobin. Complete blood count. I look at these to check for anemia. I look at these to check for infections. I look at these to check for bleeding disorders. If your hemoglobin's low, that could mean anemia. And we might need to correct that before surgery. High white blood cells? That could be a sign of infection, which could actually delay your surgery. Platelets. They tell me about your bleeding risk. Next, blood sugar. Fasting. Random. This tells me if you have diabetes, or if stress is messing with your sugar levels. Poorly controlled diabetes can slow down healing and increase your risk of infection, so I use this info to plan your insulin and fluids during surgery. Serum electrolytes, sodium, potassium, chloride, calcium. These are the body's chemical messengers. If your potassium's off, it can mess with your heart rhythm. Sodium imbalances can affect your mental status and fluid balance. We always correct these before anesthesia. Renal function tests, urea, creatinine, urine analysis. I need to know how your kidneys are doing, because that affects what drugs I can use, and how much fluid you'll need. Bad kidneys mean higher anesthesia risk. Blood grouping and cross-matching, super important, especially for big surgeries. If you need a transfusion, I want to make sure we have the right blood ready to go. ECG, the heart check. I'm looking for arrhythmias, signs of heart disease, so I can plan how to manage your heart during surgery. And a chest X-ray. This helps me spot infections, heart issues, especially in older folks or anyone with lung problems. Now sometimes I'll order specific investigations based on your condition or the type of surgery. X-ray, CT scan, MRI, or maybe an ultrasound to check your organs if it's abdominal surgery, urological surgery, gynecological surgery. So why do all these tests matter? First, they give me a baseline of your health. Second, they help me spot any hidden risks, diabetes, high blood pressure, anemia, that could complicate things. Third, if I find anything abnormal, I can fix it before surgery. Fourth, these results help me plan your anesthesia safely. And finally, they help us document everything for your safety and peace of mind. Bottom line, preoperative investigations are the foundation for safe surgery. They help me predict risks, prepare for anything, and make sure you get the best possible outcome. If you're heading for surgery, don't skip these steps. Your future self will thank you.